Here we are gathered today, and thank you for fighting the fight in this room, which we're happy to have a room, but the leadership told us, the Republican majority told us that we could not have the House recording studio take this public. So we thank the members of the press who are here for their resourcefulness with the technology to get the message from this room out, which has been barred by the Republican majority. It's amazing what lengths they will go to so that they don't have to listen to the voices of women. We're honored that you're here. Thank you for your courage. Please proceed with your testimony as you wish. Ms. Sandra Fluke.
Leader Pelosi, members of Congress, good morning, and thank you for calling this hearing on women's health and for allowing me to testify on behalf of the women who will benefit from the Affordable Care Act contraceptive coverage regulation. My name is Sandra Fluke, and I'm a third-year student at Georgetown Law School. I'm also a past president of Georgetown Law Students for Reproductive Justice, or LSRJ, and I'd like to acknowledge my fellow LSRJ members and allies and all of the student activists with us and thank them so much for being here today. We, as Georgetown LSRJ, are here today because we're so grateful that this regulation implements the nonpartisan medical advice of the Institute of Medicine. I attend a Jesuit law school that does not provide contraceptive coverage in its student health plan. And just as we students have faced financial, emotional, and medical burdens as a result, employees at religiously affiliated hospitals and institutions and universities across the country have suffered similar burdens. We are all grateful for the new regulation that will meet the critical health care needs of so many women. Simultaneously, the recently announced adjustment addresses any potential conflict with the religious identity of Catholic and Jesuit institutions. When I look around my campus, I see the faces of the women affected by this lack of contraceptive coverage. And especially in the last week, I have heard more and more of their stories. On a daily basis, I hear from yet another woman from Georgetown or from another school or who works for a religiously affiliated employer, and they tell me that they have suffered financially, emotionally, and medically because of this lack of coverage. And so I'm here today to share their voices, and I want to thank you for allowing them, not me, to be heard. Without insurance coverage, contraception, as you know, can cost a woman over $3,000 during law school. For a lot of students who, like me, are on public interest scholarships, that's practically an entire summer's salary. 40% of the female students at Georgetown Law reported to us that they struggled financially as a result of this policy. One told us of how embarrassed and just powerless she felt when she was standing at the pharmacy counter and learned for the first time that contraception was not covered on her insurance, and she had to turn and walk away because she couldn't afford that prescription. Women like her have no choice but to go without contraception. Just last week, a married female student told me that she had to stop using contraception because she and her husband just couldn't fit it into their budget anymore. Women employed in low-wage jobs without contraceptive coverage face this same choice. And some might respond that contraception is accessible in lots of other ways. Unfortunately, that's just not true. Women's health clinics provide a vital medical service.